Tonight, President Trump increasingly defiant about his decision to take the controversial anti-malaria drug hydroxychloroquine, despite no evidence yet that it prevents coronavirus.
I think it gives you an additional level of safety, but you can ask many doctors are in favor of it. Many frontline workers won't go there unless they have the hydroxy.
A point he doubled down on later in the day.
Hydroxychloroquine is used by thousands and thousands of frontline workers.
But the country's largest medical association says it is not aware of any data showing frontline workers are taking the drug. The FDA has warned against using hydroxychloroquine outside of a hospital setting due to a risk of serious heart problems and in some cases even death. And similar findings in another study funded by the University of Virginia and the NIH, which used data from patients at veterans medical centers, a study which the president attacked today.
They were giving it to people that were in very bad shape. They were very old, almost dead. It was a Trump enemy statement.
The president's stunning revelation Monday surprised even some of his own top advisors.
I happen to be taking it.
Hydroxychloroquine?
I'm taking it, hydroxychloroquine.
House Speaker Nancy Pelosi reacting.
I would rather he not be taking something that has not been approved by the scientist, especially in his age group and in his, shall we say, weight group, what is morbidly obese, they say.
Sparking a bitter back and forth today.
Oh, I don't respond to her. I think she's a waste of time. Pelosi is a sick woman. She's got a lot of problems, a lot of mental problems.
I didn't know that he would be so sensitive. He's always talking about other people's avoirdupois, their weight, their pounds. His words weigh a ton.
And the president revealing he started to take the drug after one of his staffers tested positive for the virus.
A very nice young gentleman, he tested positive.
Meantime, the vice president, whose press secretary tested positive, said he is not taking hydroxychloroquine.
My physician has not recommended that, but I wouldn't hesitate to take the counsel of my doctor, or any American should do likewise.
NBC's Dr. John Torres.
Don't listen to other people when they tell you to take medicines like this because, again, the benefit might not be there, but the harm certainly could.
And in a statement tonight, the FDA reiterated the decision to take any drug is ultimately one between a patient and their doctor.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.